There was a time when running was just about training hard and putting in the miles, but we now know that to run your best and avoid injury, you must also work on developing proper running biomechanics and an efficient stride. There are numerous factors that are necessary to achieve an optimal stride, but perhaps the most basic prerequisite is adequate muscle and joint flexibility, at least at the lower extremity. Simply stated, if your muscles and joints cannot move freely through the ranges needed for an uncompromised running stride, you have no chance of running with proper mechanics. To help you assess your running flexibility, we have outlined a simple screening procedure to help you detect some common movement restrictions that may be keeping you from running your best. What follows is a brief description of each test, including how to perform and score the tests. If you fail one or more of these tests, it is an indication that you have a flexibility restriction that is likely limiting your running stride. Specific corrective exercises are beyond the scope of this video. However, more information about how to correct any identified restrictions, including a full written version of the running flexibility self-assessment test, along with recommended stretches for each failed test, can be found on our website. The standing calf range of motion test will assess your calf and ankle mobility. To perform the standing calf range of motion test, begin with your toes positioned 4 inches away from the wall. Keeping your heel firmly in contact with the ground and your knee directly over your toes, bend your ankle and knee to bring your knee towards the wall. If your knee can comfortably touch the wall from this position, give yourself a pass for this test. If either knee cannot touch the wall, it is an indication that your calf and ankle are tight and lack the full motion required for an unrestricted running stride. The first toe extension range of motion test will assess the flexibility of your first toe, which is important for a proper toe off. From a kneeling position, keep both your heel and the ball of your foot flat on the floor. With your foot relaxed, gently pull up on your big toe as far as is comfortable and note how far the toe comes off the ground. If your toe can be lifted 2 inches off the ground, which equates to 65 degrees of toe extension, give yourself a pass for this test. If either toe cannot be lifted this high, it is an indication that your toe is restricted and lacks the full motion required for a proper toe off. The hip abduction range of motion test will assess the flexibility of your adductor muscle group, which is important to ensure muscle balance and stability around your hip. Lie on your back with both legs fully extended. Keeping your toes pointed towards the ceiling, slide one leg away from your body as far as possible. Repeat on the opposite side. Under normal circumstances, each leg should be able to slide out 40 degrees. Anything less than this, or differences in flexibility between the right and left legs, is an indication that your hip adductors may be tight and compromising your running stride. The modified Thomas test will assess the flexibility of your hip flexor muscles. Sit on the edge of a table or bed. Your hip bones should be as close to the edge as possible. From this position, lie back and pull one knee up to your chest while contracting your stomach muscles so your lower back is flat against the table. Now let the opposite leg hang freely over the edge. Keep this leg completely relaxed throughout the test. Note the angle formed between the thigh with respect to the horizontal, and then repeat on the opposite side. Under normal circumstances, your thigh should be able to reach horizontal or slightly below, and your right and left sides should be the same. If this does not occur, it is an indication that your hip flexor muscles are too tight and may be restricting your running stride. The active knee extension test will test the extensibility of your hamstring muscles. While lying on your back, pull your thigh up with your hands so your knee points straight up towards the ceiling. Straighten your knee as far as possible without letting your thigh drop down towards the floor. Repeat this motion on the opposite side. Under normal circumstances, you should be able to completely straighten the knee, or at least come very close to this. 10 to 20 degrees shy of vertical would be considered normal. Also keep in mind your right and left sides should be symmetrical. If this does not occur, it is an indication that your hamstring muscles are too tight and may be limiting your stride. The Pro Knee Bend Test will test the flexibility of your quadriceps. To perform this test, lie on your stomach with both knees fully extended. From this position, flex one knee and use your arm to gently pull your foot towards your hip. You should not feel any pain in the lower back, and the front of your hip should not lift off the ground as you do this. Under normal circumstances, you should feel a light stretch on the front of your thigh, and you should be able to touch your heel to your hip. If you cannot reach your hip with your heel, or if one side is more flexible than the other, it is a sign that your quadriceps may be restricted and limiting your stride. The hip rotation test will test the flexibility of your hip internal and external rotation. Lie on your stomach with one knee bent so your lower leg is pointing towards the ceiling. Let your foot rotate out away from your body as far as possible, and note the angle formed between your shin and vertical. Now let your foot rotate in towards your opposite leg as far as possible, again noting the angle formed between your shin and vertical. Under normal circumstances, you should be able to rotate approximately 40 degrees to either side, and your range of motion should be even when rotating the hip in and out. You should also have symmetry between the right and left sides. Restricted range of motion or asymmetry between sides is a sign of tight hip rotator muscles, which may be limiting your running stride.